Welcome back to another episode of 10 Minute Mood. Today I want to talk about ADHD and in particular women and their experience of ADHD. The diagnosis of ADHD in adulthood is becoming more and more common. For years, ADHD was really the domain of children, and these sorts of images and tropes of hyperactive boys who can't sit still in the classroom seem to fill the collective consciousness of what ADHD looked like. But things have definitely been shifting in recent years. And so now it's more common to hear about boys and girls and men and women receiving a diagnosis of ADHD. So I wanted to take 10 minutes to discuss what ADHD might look like for women in particular, and very much focusing in on adult women and their experience. So if you find that some of this resonates with you or with someone you care about, then we run a 10-week online group that teaches various skills useful for adults with ADHD. It also provides education about what it all means, how to be successful and to thrive with ADHD rather than fighting against the symptoms. And we run this group several times a year, and we have an online version of the group as well, so you can join from anywhere. So if that interests you in the slightest, then please check out the information on our website or in the description of this podcast to find out more. But let's move on to the discussion now around women with ADHD. So we know that whereas men are more likely to have that hyperactive kind of ADHD that might be more outwardly obvious, women have a tendency to exhibit inattentive ADHD, and that makes it hard to focus, to pay attention to details, to stay organized, to listen for long periods of time, to really be engaged in conversations, and to remember things. So these inattentive symptoms are less obvious to other people, right? They're less outwardly obvious. They can also be more easily disregarded as just signs of someone not putting in effort or someone who's a bit checked out. Common labels you might hear for women with an undiagnosed ADHD are, she's spacey or forgetful or lazy. The classic not living up to potential. These are common ways in which inattentive symptoms of ADHD might be explained away by other people in their life, whereas those outwardly hyperactive symptoms in men may be more likely to be picked up as symptoms of something that could use extra support or intervention to help them. So in this way, women are often missed in terms of extra supports that might be useful for them. And I think it's also true that the way in which hyperactivity might display in women can be different to what we might first imagine when you hear the word hyperactivity. So women may present as bubbly or chatty or talkative, high energy at times, animated, enthusiastic. These can all be ways that a more socially acceptable form of hyperactivity comes to be presented, especially after a period of childhood where other ways of behaving in a hyperactive manner may not have been reacted to well by people in their lives, by adults in their lives, or even by other peers in their lives. And so the hyperactivity sort of gets channeled into these other more acceptable modes, such as talkativeness. So that's also something to look out for. There's also an internalized sense of hyperactivity. Again, this is hard for someone outside of the person to really pick up on, right? But there's this internalized sense of restlessness often, a difficulty with feeling calm or settled. It can often be the case that for women and girls, this more inward-facing form of hyperactivity, again, is manifest, and they may appear otherwise rather still or not what you might think of as hyperactive from the outside. However, inside they may be experiencing a very near to constant level of restlessness. We also know that recent studies of women with ADHD show us that they appear to experience more psychological distress and have lower self-image than men with ADHD. And again, these are these are averages and generalisations to some degree. But it is an interesting thing to note that for women, it appears that the difficulties that they experience can result in greater psychological distress and have much more of an impact on their self-image than for men. Also, recent research suggests that husbands of women with ADHD are less tolerant of their spouse's ADHD patterns than wives of men with ADHD. There can be an increased focus on their symptoms, an increased focus on the things that they find most challenging, that may be difficult for the person without ADHD to be understanding around. And women with ADHD often feel, especially when I talk to them, talk to my clients, they often feel that their lives are out of control or they're in chaos. So daily tasks may seem impossibly huge. There's a sense of paralyzing overwhelm that for a period of time they may be able to keep across everything that they have to do and keep across all the different roles that they play in life. And then all of a sudden it's like the rug has been pulled out under them and all the pieces just seem to collapse, and it just seems like there are so many pieces to pick up and it's hard to know where to begin. So the sense of overwhelm coupled with paralysis, the just not knowing even where to begin, the sense that there are so many decisions to be made, so many actions to be taken, and trying to order how one might go about doing that can all just seem incredibly overwhelming for these women. So if we think about treatment for women with ADHD can be very similar to that for men. So finding a psychologist or a therapist who can help them to explore their individual profile. So what are your individual areas of strength and of challenge? What is your exact symptom profile? And also, what are the things that you're really good at? Identifying the person's core values. So what matters most deeply to you? What are the things that fill you with the greatest sense of purpose? It's really important to do some of that values work, because then you can work with the person to find ways to orient their actions towards what is meaningful. Like what are meaningful activities in your life? And how can we leverage your strengths and find new ways of relating to your difficulty so that they don't become barriers to you taking part in what is meaningful to you? So therapy is not about becoming a robot. It's not about becoming like a person who doesn't have ADHD. I think it's very much about acknowledging the symptom profile of ADHD and trying to identify what matters most deeply to you and coming up with your toolbox and your skill set around knowing what I know about myself. How can I best work to navigate towards doing what matters most to me without getting stuck in the struggle against the things that I find difficult? So there is the therapy component, which is much the same as it would be for men. However, when it comes to women, the more recent research indicates that there is this importance of hormones and hormonal changes. A decrease in estrogen can make ADHD symptoms worse. So really taking into account a woman's menstrual cycle and any birth control that they might be on is an important factor in understanding their symptom profile and how it may fluctuate over time. And similarly, the period of pregnancy or of menopause will bring unique challenges for women with ADHD. So helping women to become aware of that and to plan for it accordingly, so it's not some great surprise. This can mitigate the feelings of stress and overwhelm that may arise when these symptoms suddenly become worse during what is already often quite stressful periods in their life and periods filled with change. This has really just been a very brief overview, and if you're interested in finding out more about this topic, please do get in touch. to either book an appointment with a psychologist to find out more about whether or not this is relevant to you, have a look at the ADHD group which we run, and to get a sense of whether or not that might be relevant to you or to a loved one. Send us an email, give us a call. Our contact details for Sydney City Psychology are in the description. Have a look at our website. We have lots of resources, free resources available on our website. Let us know what would be useful for you. And I hope that you've taken something away from today's discussion, something new that you didn't know prior to listening to this, and that this 10 minutes has inspired you to be more curious, I guess, to the people in your life and their differences, and the unique way in which we all navigate the world and our daily challenges. So thank you for joining me, and I look forward to talking with you next time.